There are various reasons for this, but the primary reason is an excessive accumulation of what's called ectopic fat, which means fat where it shouldn't be. When your body needs to store calories, it can store it in the form of glycogen, which is in your muscles and liver. It can also store fat under the skin called subcutaneous fat, which is a safe storage of fat. However, once the fat starts depositing inside your belly, in the liver, in the pancreas, around the organs, that is metabolically active or damaging fat. And it is this increasing level of ectopic fat or visceral fat deposition, often with reducing muscle mass, which leads to the cascade of metabolic disease in a person who is genetically predisposed to this. Of course, there are other parameters as well: lack of activity, lack of fitness, gut microbiome dysbiosis, hormonal imbalance, menopause, andropause, chronic systemic inflammation, worsening insulin resistance, circadian imbalance. There are so many other factors as well which lead to metabolic disease, but the biggest cause by far is excessive accumulation of belly fat and loss of muscle in an individual who is genetically predisposed to metabolic disease. This MRI scan here is a good illustration of that. On one end, you have a skinny fat person. You can see a lot of red, metabolically active, visceral or dangerous fat around the belly. You can also see that there is not a lot of the blue colored under the skin subcutaneous fat, and also not a lot of muscle mass in the legs and shoulders. On the other hand, the other image shows a person who technically has a higher body mass index, but is likely metabolically much healthier, because you can see he's got less metabolically active visceral fat, more muscle mass, and also more subcutaneous safe fat under the skin.